I'm Ray Watts, and I'm president of the University of Alabama at Birmingham. I'm also a professor of neurology and have been studying Parkinson's disease for 30 years now. I've dedicated a great part of my career to developing new treatments and understanding the disease more. And certainly over my years of practice, one of the things that I've observed is my patients who exercise rigorously do better over the long term. At UAB, under the leadership of Dr. Marcas Bamman, we have developed a center for exercise medicine. And the purpose of this center is to truly bring exercise in as a therapy for serious life-threatening diseases.
The Center for Exercise Medicine is a university-wide center. They were created to work across the university, but we've had a very tight relationship with them since the early days, really. Marcas Bamman is the director of the Center for Exercise Medicine. He's really a fantastic exercise physiologist, a very strong background in understanding how exercise affects the body. And we partnered with them early on to study Parkinson's disease.
I think the Center for Exercise Medicine plays a very important role in improving the quality of life in individuals with chronic disease, including those with Parkinson's disease. We are trying to lay the foundation, an evidence-based foundation, for exercise prescription in a way that it will become very high profile in clinical care.
I honestly can't think of another place that has a center quite like this, and to have this close connection between people who are studying exercise and people who are studying human diseases like Parkinson's and others is really a tremendous opportunity to try and ask the question of how does exercise affect the course of human disorders.
A follow-up to our initial study in terms of the impact of exercise training on the brain and cognitive function is to do a really critical analysis, a detailed analysis of brain function. And to do that, Dr. Kimberly Wood, who has expertise in brain imaging, is going to be taking that on in a new study looking at the impact of high-intensity exercise training on brain function and how that relates to changes, clinical changes, in measurements of cognitive function.
So this current study is going to have Parkinson's participants come in for a brain imaging session and then participate in 16 weeks of high-intensity exercise and then come back in at the end of that training period for another brain imaging session. And what we hope to see is changes in brain function and also brain health in Parkinson's patients, and hopefully observe long-lasting changes in motor and non-motor symptoms, including improvements in memory.
One of our ongoing studies now, which is getting underway, is involving this same high-intensity exercise training program as we've done before, but now really focusing in a laboratory setting on sleep quality and a variety of outcome measures associated with that in a sleep laboratory. So Dr. Amy Amara in neurology is a physician very much interested in sleep quality in individuals with Parkinson's disease. We think that's an important next step. It's not been studied at all in the context of exercise and its potential impact on sleep quality.
Sleep dysfunction is one of the most disabling symptoms that Parkinson's patients experience, and to be able to come up with an intervention that may help those patients is very exciting, and to do one that is a non-medication intervention is even more exciting because it doesn't come along with a lot of the side effects that many medications can. I think we have a real opportunity here to improve quality of life in patients with Parkinson's disease. We know through Dr. Bamman's study that exercise can improve motor outcomes and also improve muscle health. And I think this is a great opportunity to find out how it might impact sleep health as well.
So ultimately, our goal is to move exercise from research to medicine. What does that really mean? It means to provide the evidence base that will change clinical care.
The partnership with the Brian Grant Foundation and the Parkinson's Association of Alabama and our team at UAB is an exciting one. And we are all very positive about the outcomes. And we want to go about it in a way that empowers our patients and their families to help control their health and their wellness.